And we're going to introduce our guest to your Health with Terrebonne General Medical Center. On your left is Dr. Maura Ogden, internal medicine of ostomy, continence. She is the director of the wound care clinic. And Abby Benoit, who is an RN, am I saying this right? Ostomy continence nurse.
Wound ostomy continence nurse.
I did it. Okay. Y'all threw me a curve,
okay.
but that's all right. We got it. But y'all both are Saints fans, right?
Yes, we are.
That's the most important thing. All right. Who should seek treatment at Terrebonne General's Wound Care Center? Abby, I think you're first up.
Okay, we typically classify our wounds as either chronic or acute. When we say acute wounds, we typically are talking about like trauma wounds. That could be your simple cut, abrasion, and surgical wounds, which of course are surgically created. The chronic wounds are of most importance to us because your acute wounds heal in a timely fashion, but the chronic wounds don't respond to the type of treatment you're using and take a lot longer to heal. These wounds could take anywhere from several weeks to months to even years. So this is typically the type of patient that we see with the chronic type wounds. It's actually hard to believe, but there's over 6 million Americans that suffer from a chronic wound on a yearly basis. So this just shows how important wound care actually is to our healthcare or to the healthcare industry. So if a wound's not showing progression, hasn't healed within 1 to 2 weeks, these are the patients that we would like to seek treatment at our office or at our wound care center. These wounds can cause very severe emotional and physical stress for the patient, but not only the patient, for the family members or caregivers as well. And it also, they pose a very significant financial burden for these patients as well as our entire healthcare community. Therefore, seeking treatment for these types of wounds in a timely manner becomes very important.
What was that number again? That was a staggering number.
Over 6 million.
Oh, wow.
Yes,
okay.
yes.
So what does Terrebonne General's Wound Care Center, what do they have to offer the community?
Well, we have a comprehensive wound care center, and we kind of approach patients' wounds in a multidisciplinary approach.
Okay.
When patients come in, we assess their nutritional status, the status of their disease process, whether that be diabetes or vascular disease. And then we try to assess the actual etiology of the wounds themselves, because that helps us decide what type of treatment they'll need for their wounds. We see a variety of different wound types, pressure ulcers, which are basically bed sores, and we see those with our bed-bound patients or paraplegics. We also treat venous stasis ulcers or arterial wounds, and those are patients with disease of their veins in their legs and also their arteries. We see a lot of diabetics who lose sensation, and then they end up with diabetic foot ulcers. Burn patients also come to our clinic, and we give them treatment as well. Sometimes when people have surgeries, their wounds, their post-surgical wounds become complicated, and they require, an extended period of time to actually get those wounds to heal.
How does a patient become established at the care center? When do they start receiving care? They got to feel, I guess, their comfort zone. When do they get established?
Well, any patient, like I said, that has not shown any improvement or signs of healing in their wound within a 1 to 2 week period, or even patients with like a very large wound or very complicated wound would be good candidates for treatment at our center. They can call and set up an appointment either through their family physician or even self-referrals. Same thing goes for our diabetic foot care patients. And our ostomy patients, which when we speak of ostomy patients, a lot of people do not understand what an ostomy is. An ostomy is actually a surgically created opening from a part of the body to the surface of the abdomen. These openings are created to rid the body of waste. This could be either urine or stool, and they're typically categorized or named based on their location. If we're talking about the bladder, it's a urostomy. If we're talking about the large intestines, it's a colostomy. Small intestines, it's an ileostomy. What we do for these patients is we actually help them with education on dealing with this new thing that can be very uncomfortable for them, and also with techniques for pouching to contain the waste. And sometimes they develop complications on the skin around the stoma, so we would help them with those types of situations. When we're speaking of the diabetic foot care, a lot of people wonder, well, what's entailed with that? Well, that's actually for our elderly population who they're diabetic and they suffer from neuropathy or loss of sensation to the feet. We actually do nail trimming for them. Yeah. So that there's no safety risk with them trying to do that procedure without having the sensation that they have.
We also check them for calluses and just make sure that there are no pre-ulcerative lesions on their feet, because a lot of times they can't see what's going on underneath.
So that's where ostomy comes in. See, I
Yes.
learned something new tonight. Hold that thought. We're going to take a break, hear from TGMC, and then when we come back, we'll have more on this important center. Don't go away.